All right, we got the ding.
Good.
We got the ding of recording. All right. Um, so Tim, just obviously I know you from all of mom's stories and all of
Right.
that. But give yourself a lovely introduction. Who is Tim?
Well, Tim is Tim Thorne. I'm 62 years old, soon to be 63. I found out I was HIV positive June 26, 1984. And I have lived through the ups and downs of everything and am now considered a long-term survivor. And I have had many opportunistic infections over the years, and I've had many different um, sudden illnesses that come out of the clear blue sky and put you in the hospital. And in moments' notice, when you're sitting there one day and the next day you're in the hospital and you don't know why. And stupid things like a medication that somebody thought you should take, and you took it for 4 days doing exactly the right thing, and it ends up in the hospital. And
Oh
then,
Lord.
oh yeah, that was just that was just a year and a half ago.
Was
Oh
it was it a trial medication or was it just
yeah,
like
no, they had a doctor had misdiagnosed me with something. They thought I was retaining fluid instead of having lipodystrophy, and they gave me a large dose of what's the I'm trying to think of the name of the drug, Lasix. And they didn't tell, and I went in to do a procedure and they couldn't do the procedure because it wasn't water, but they didn't tell me to stop taking the Lasix. So
oh
3 days
no.
later, I ended up in the hospital with a sodium imbalance. My sodium levels were like in the 90s or something. Compared, they're supposed to be around 130. I drove to the hospital.
Oh Lord.
Huh. That's New Hampshire stock for you.
Amen. We are a stubborn people.
Exactly.
Um, so back in 1984, when you got that diagnosis, what were those first few years like? Were you having any symptoms? Um,
Not really. And if I was, I certainly wasn't telling anybody but my mother and my father because they were medical professionals and they would talk with me through things. We kept it under wraps back then. They get very much under wraps because the way everybody in the country was crazy with scared, they wouldn't let you use utensils, they wouldn't want you in the house, it was a lot of craziness. Over the course of time, I did get sick, and by the 90s, by 1994, I had been working really hard, and I ended up in the hospital with PCP. And at that point, it was you were lucky if you made it out of the hospital. Um, 95% of the people that entered into a hospital with PCP and the other things that I had going wrong died. But luckily, one of the doctors took note of me and knew me and did went through extra rounds of helping me to so that I could live. And that's when the beginning of me understanding that I had to communicate with medical professionals and other than my parents, of course. And that's when I learned that I have to, when I really became comfortable with speaking my truth out loud to people, because if I'm one person with a voice, and I've been this way for years now, if I'm one person with a voice and say out loud that I'm HIV positive while I'm sitting in public, people other people who are HIV positive will start feeling comfortable with themselves in order to do it. And I've helped over the years, I can say hundreds of people that have needed help and direction. And I've been very blessed to be able to do that. That continued with my outreach for Grifta SV, being their new face of the medication for this year. And I wanted to do something that would reach people like myself, and it's in my situation with my disease at this point, and who need help with their abdomen. And there are people, but they're all around the country, and they're tired of asking for things because they're taking a lot of meds, and all these meds have side effects. The side effects range from uncomfortable to very, very hard to take. And they're not easy. Once you start them, you can't stop them. And they you become very comfortable taking them only because you're not getting sicker. But that doesn't mean that it's any easier to take these horse pills every day and swallow them and get them down.
Yeah, it doesn't improve that quality of life. It kind of just plateaus it, if anything.
Right. It allows you to continue on, and you have to you have to make personal decisions that you are going to do this, and you are going to make the effort to do it because it's your life and your choice. It's hard to get people to make that decision at first. They get the news and immediately, it's not as bad now, but back then it was a death sentence. I mean, you if you were HIV positive, your clock was ticking, and it wasn't, you were 5 minutes to midnight, and they didn't know when it was going to stop. But luckily they've changed that now with new meds.
What if I can ask off of that, when you were saying how sometimes you have to find your own drive to do it, what was your drive to keep taking the meds and to also get involved with the clinical trials that you've done?
Well, I I knew early on that the only way to fight this was to take it head on. I've I've been a leader when it comes to things like that throughout my life. I learned it when I was young, and I also learned that the only person that's really honestly besides your parents that are going to take care of you is you. And along the way, if I had issues getting this or doing this particular aspect, I asked questions and found out more, and then I disseminated that information because there are, for every one person like me that has a voice, there are 100 people behind me that don't dare speak it and don't ask questions. And I've been known to sit in a bar and just sit there talking to a friend of mine about this, that, or the other thing. Somebody hears and they had never heard about that conversation that way before, and they feel free to come and talk to me about it. That they can be a complete stranger. That's perfectly fine. And that's the way it is. That's hard for many people to do. But over the years, we've got more people like that. There's a younger crowd now that are like that. There are a few like that that are out and willing to speak openly in front of many people and just say it like it is. It's not as taboo anymore as it used to be.
Yeah, it helps break down that stigma that I can imagine was really, really rife when you were first diagnosed, and that you've
Exactly.
had to live throughout the entire process.
Well, the whole being gay thing has come a long way in the past 30 years too. I mean, it gay and HIV got put in the same spot in the 80s, and everybody kind of pushed gay out. and get, oh, well, you got to be sick, or you have this, or you have that. And people were so dramatically away. And then there were others that were the act up people in your face, and people didn't like that either. So now it's just a more balanced thing. Now they're more scared of drag queens than they are of HIV, and there's always something, there's always got to be some type of demon for people to fight with. And luckily, HIV is not part of that demonization anymore.
Yeah. And that's honestly, it's good. It's really good to see.
Mm-hmm.
I wish there were no demons, but
Well,
we'll get there.
Yeah, your mouth to everybody's ears.
Oh yeah. So when you and I were chatting before I started recording, you were talking about the relationship between the patient and the nurse and the doctor, and I was wondering if you could expand on that a little bit.
Sure.
What you found that's been helpful, what hasn't been helpful. Yeah.
One of the main things is to develop a communication, an actual language that you are able to communicate to the patient. And you, after speaking with the patient, you get them to open up enough so that when you're talking medical terms, that they actually understand. In other words, the blood pressure, this and that, that's just the beginning. When you start talking to them about why they're there today, try to get them to have specifics. If they have specifics and they have a list that they can give you, then you can read the list, talk with the patient again. So now you're reading their language and you're getting the information. And thereby, when you go to the doctor before he sees the patient, you can explain what's going on to him in more detail. And that allows the doctor to be able to come into the patient and speak the patient's language to them. It's very important to develop a relationship with each patient, because many patients will come in and they're not going to ask questions. They're just there because they're told they had to be there. They're just there to get the pills that they need to take so they can live. They don't want to ask any questions. They don't want to be involved. Or it's the other way. They're scared to death of every single thing, and they're scared of getting it wrong, so they don't do anything. Because that, there's a lot of that. I've known people. My best friend of 25 years refused to go in and ask questions at the doctor's office, and he would talk to me all the time. And before he'd go to the doctor's office, I would take a notepad and write notes down for him to hand to the doctor, to the nurse, to ask these questions of Chris and talk to him, because he just couldn't do it. He felt it was over his head, and that it wasn't. It just wasn't. Over the years he got better with it, but there were things, he were things that he just chose he didn't have to know about, and he didn't want to know about. Everything's okay, till it's not, and I'm picking him up and driving him to the emergency room.
Yeah.
That
and unfortunately that can happen really quickly.
Exactly. And happened more than once. There are quite a few people that's happened to. And hell, it's even happened to me. And I've been pretty lucky most of the time. A little bit stubborn. I know better than to be almost passing out and driving to the emergency room. But, at the time, it seemed like I'd get there faster if I drove than if I wait for them to come come to the building, come inside, come to the top floor, and put me in a gurney and drag. That seemed like a lot more problem than it was worth.
That is so New Hampshire, and I love it. Like, I'm just gonna take care of it myself, and we can take 12 steps, and we can make them one. It's
Yeah.
So if you don't mind me asking, are there any symptoms that you live with on a daily basis due to your HIV? And if you don't mind explaining those a little bit.
Well, one of the things is that I have to do is the HIV medications that I take, the protocol that I take, Criscobix and Tivicay, those two medications are harsh on your stomach and your intestines, and I deal with constant bloating and constant diarrhea. And I have to take another medication, Mytesi, that slows that down enough so I don't have to go from bathroom to bathroom and plan my trip around bathrooms. I also have another drug that I have to take because the side effects of the HIV meds create acid reflux. So I have to take omeprazole that I probably wouldn't have to take other than taking those meds. I have to give myself an injection every day for lipodystrophy called the Grifta SV. That's because I get adipose fat and around my intestines and inside the wall lining of my abdomen, and it compresses. Because of that, I have to take high blood pressure medication, and because the whole concept, you can't have your abdomen being squeezed together by fat without it creating a higher blood pressure. And because of age and because of the medications, I have to take calcium medications. I can't name it off the top of my head, but there's that. I end up taking 23 different pills, different medications every day.
Good Lord.
Yeah, it piles. It piles up after a while. I mean, I can show you something that would give you the idea. These are my weekly meds. And in the morning, let's see if I can get it out without knocking everything asunder. Yeah. In the morning, I guess you can see. You can see that now, right?
Yep.
Yeah, I take this in the morning and another handful similar to that at night.
Oh wow, that's a lot.
Yeah.
And especially medications to manage the side effects of other medications too.
Exactly.
That's always really, really tricky because.
And that's the thing. People say, oh, you only have to take one pill now. Well, it's only one pill for a while, because pretty soon it ends up with the side effects from that one pill. You end up taking other pills.
Yep.
So, it's not, and they keep advertising it as if it's like, not dialysis, diabetes. It's you manage it every day with just one pill a day. Well, diabetics don't just do one injection a day, and they have to do a lot in order to survive the day. And, and they don't seem to, that one pill thing is just something crazy in your head. It's the same thing if you're just taking it to be on prep. It's
Yep.
the same side effects. People aren't realizing that these medications really do have bad side effects to them. And even if you don't have HIV and you're taking these meds, you will receive those side effects. Constantly checking my liver function, constantly checking my kidney function, because these meds really test your kidneys. You have to make sure that you drink tons of water every day, because if you don't flush it out of your system, you're just starting over with more, and it just compounds in your system if you don't flush it out.
Yeah. So definitely really what are some other things other than the medication and the hydration that you found um helpful getting through the day?
uh Activity. You have to be able to get physically out and either walk or hit the treadmill, or the combination of that and some weights. You've got to do strength training, because these medications, one of the severe side effects of it is neuropathy. And neuropathy ends up, you lose the you have tingling sensations in your hands and your feet. And if you don't keep your circulation going, you will lose a certain degree of intensity of feeling in your fingers, in your feet. And if you're not moving and keeping your blood moving, and staying in adequate shape and eating well and adequately to, you know, nourish your body, you have to make more of an effort, because you're taking pills that are really bad for you. So you've got to take supplements that are good for you, that don't, and make sure they're not ones that compound your liver and your kidneys. Just because you think you're taking good ones, make sure you are taking the right ones. Go asking your doctors and or nutritionists what you should be taking and the doses. That's very important. Nutritionist is topmost, because people, you can think you're eating okay, and come to find out you're doing exactly the wrong thing for the medications that you're taking.
Yeah, absolutely.
It takes a village to raise one HIV positive person. It really does.
How many specialists, doctors, all of those do you think you see if you had to like give a ballpark?
I well, considering I just added three more, I now see, over the course of a year, I probably see 12 different specialists. But I just added three more on because of the oral cancer.
And if you don't mind the question, is the oral cancer related to the HIV? I mean, there's not really much that
It,
like
it's more kind of related to smoking.
okay.
That, that it, maybe the HIV allowed it to come out a little bit, but you know, smoking off and on for 40 years doesn't help. That's
That-
you know, yeah, you gotta, the good with the bad. You gotta be honest about it. I smoked. This is what happens to people. But at least I have great ENT, and he believes that he'll be able to remove the cancer and the cancerous areas and have minimal loss of function of my mouth.
That's awesome.
Yeah, yeah.
That's fantastic. So looking towards speaking to like the new generation of nurses and all that, is there anything that you'd like to say that to make sure that things keep happening, change things that have happened before that maybe didn't go well?
One of the things that I would suggest is make sure that you keep a friendly professionalism. And the reason I say that is when people come in, they if they if you react predictably more times than not, they will be able to predict how, what your reaction will be, and they will feel comfortable giving you questions. For instance, my primary physician, Gail, and I have a wonderful relationship. It's almost to the point of shorthand. We can have a 5-minute conversation and cover a bunch of things all at once. And that's because I know how she's going to react each and every time. And she knows, and we have a familiar communication way of communicating. Now, when I say that's easy, it's not. I'm an easy one because I'm vocal. I'm accustomed to speaking to medical professionals. I'm accustomed to asking questions, and I'm accustomed to that. There are a lot of people that are not accustomed to talking that way. And you're reacting the same way every time, being predictable will be the easiest way for them to be able to say, "Oh, I can ask this question because I know how they're going to react." You know, they may not come from, they may have people that fly off the handle and everything else, but they know they can come to you, and you're going to react in their best interest every time. Consistency is the greatest success of medical professionals.
Absolutely. I like that because that's something that we see threaded throughout in a lot of the other conditions that we look at, but that's the first time it's like hearing you say that, it really makes it click that the best way that we can interact with people is just through consistency.
Yes,
Um,
because when I can go into a doctor's office and speak with the nurse, and we can be constructive right away, it's a great meeting. And we after a while, it's just a conversation that you're used to having, and it goes so much easier. This is happening, this is happening. The nurse knows where to go. They know how, and the doctor will know how to go, and they can I'll make a decision that seems universally okay for the patient. And when the patient leaves, they want to feel like they've accomplished something by being there. Just by being there, they've accomplished something.
yeah, it gives them back some level of control as well.
Exactly, which is very important. This is a very debilitating disease at points in times. You find yourself very vulnerable, and if you get a bad actor, that they can really tear you apart and make you. I've weeded a few out over the years that had, they interjected their own personalities into things that, you know, that had no rhyme, reason, or whatsoever. They were I was at a religious hospital, and they were trying to shove religion down my throat, and that, that's something that absolutely stay away from. Your personal beliefs are yours. They do not belong in the doctor's office. That there's no in between. That you can hang all the crosses you want at home,
Mhm.
and just think in terms of the fact that you were here to serve everyone that walks in the door, because that's what you're there for. If you're going to be disease specific, be disease specific, but it's the disease. you know it's the medical profession. We're not wishing on a star. We're here for actual answers using a scientific method.
Yeah, absolutely. There's a time and a place for spiritual healing and spiritual health, and
Exactly.
it needs to have its place, but that place doesn't need to be
The doctor.
overlapping. Yeah, it doesn't need to be overlapping when you need to do the
Absolutely not.
physical.
Absolutely not. Yeah. Comfort level, because sometimes, there are things that are going to happen in a doctor's office that are uncomfortable or unflattering or, embarrassing. And all those things, as long as the nurse stays matter of fact about it, the doctor stays matter of fact about it, so it'll just go, it's just another thing. You have to do this or you have to do that. It becomes just another thing. And there's no, oh, I got something on my butt or I've got something on my penis or this or that. And you need to look at it. And, if people react the same way every time, then you will actually not have to wear it. They won't think twice about pointing something out and they won't be embarrassed by it. The HIV at times is a suffering of many embarrassments, and eventually you get over it.
Yeah, and it's having that rapport
Exactly.
across the board that makes it.
It's the trust. It's the trust. You're coming in for a medical professional and the consistency of them, and they can add the friend warmth touch factor to it, but that consistency of the way they react and the way the move, we will get you better, we will take you from here and we will get you there. The positive attitude, positive outcomes, doesn't matter what you believe in your head, just exude positive influence and positive outcome.
Yeah.
It's very important, because when you're really sick, it's hard to get past your pain to communicate. In some cases, it's hard just to communicate. And, that's where a good rapport, they will be able to talk. You'll be able to pull that out of them.
Yeah, I can absolutely. Awesome. Well, thank you so much. I'm going to stop the recording before I forget because